Good morning, everyone. So a few words from me about the plan. But before I do that, I just wanted to take the time to say thank you to all of you listening in, and to all our colleagues across the whole of the HSE for the amazing work that you have all done in this year of all years we've lived through. The commitment and the creativity and the sacrifice that you have made has been inspiring. So on my own behalf, on behalf of the board, a huge thank you for that. And also on behalf of the Minister. We had the Minister at the board meeting just over a month ago, and he specifically asked for his thanks to be passed on to you as well. So a huge thanks for that. A little bit about the board itself. We're appointed by the Minister. We're accountable for the performance of the HSE and for ensuring that the HSE changes to meet the needs of the population now and in the future. So our role really is to support Paul and his team, and to guide, to challenge as need be, to make sure that the governance of the HSE is as it needs to be. And as part of that, an expectation the Minister has of us is that we have a multi-year plan, consistent with Sláinte Care, of course, which says this is where we are going. And the idea is that ultimately, if we can show that we are delivering as expected, that we move to multi-year planning as a way of doing things permanently, and therefore multi-year budgeting as an aspiration as well. So that's where we are. So why else do we need a plan? Well, the HSE didn't just become brilliant because of the pandemic. If we go back to 2019, the European Commission published a report which showed that Ireland had the fastest improving life expectancy in the European Union, that the people of Ireland self-reported the best health of any population in the European Union. So we were getting a huge amount right. But of course, we all know that the system was running very hot, because as we have larger numbers of older people, the design of the health service for the future is not necessarily the design of the past. And that's what this plan is about. It's saying, what are the things we need to do which will make the biggest difference to improving the services that we can provide to the population as we're going to be for the next 10, 20, 30 years, and deliver the changes that are needed to support that. And the last thing I want to say, and Mark hinted at this isn't the board's plan, this is the HSE plan, but it's also the plan of our stakeholders. There's been huge engagement around the development of this. So we've done an awful lot of work to try and get this right. So hopefully when I hand over to Paul in a second, you will see that these are the things which the public see as important, which we as the staff of the HSE see as important, and our stakeholders see as important. So with that, let me hand over to Paul Reid, Chief Executive of the HSE. And thank you again.
And thank you, Chairman. And good morning, everybody, too. And just again, equally as I open up, can I just also echo Kieran's thanks to staff, everybody who's performed heroics over the past year. As Kieran has mentioned, the sacrifices people have made, the commitment you have all given. It certainly makes me proud every day to be working in the HSE, to be working alongside such a fantastic, committed workforce. And I really do want to express my thanks to you all for that. I also want to mention that I do believe, which we'll touch on later, and we've also made a much stronger connection with the public. At a time when the public needed us and needed to trust us, you were there. So I want to thank you for all of that too. Just at a very high level, it's a very brief presentation, which I'll walk through as swiftly as possible. And it's just to set out, as you see there. Firstly, you just want to reflect some of the engagement process with yourselves, with stakeholders, as the Chairman has mentioned, setting out some of the vision, the aim. What are we really trying to achieve? What do we want? What will good look like? And then just touching on some of the supports, investment in people and generally in the organisation to help you and us achieve what we're setting out to achieve, and a few closing comments. Next slide, please. Just to touch on some of the engagement process that we just had there. Firstly, as the Chair has mentioned, the board with ourselves, the executive team, and with yourselves have invested a lot of time over the past year to work on this corporate plan, to make sure that it truly reflects the priorities for the public, the priorities for our stakeholders, the priorities for our investors, which in essence are the people of Ireland, funded through government. Secondly, just as part of it, we wanted to make sure that it built on many learnings that we've had through COVID, and the connection, as I mentioned, that we have made with the public, but learn from what has happened. At times, it's hard to find too much good about COVID, but I think we can reflect about a lot of the learnings that has helped us in the health service overall. It is underpinned by the values of the HSE, care, compassion, trust and learning. And never have these values been so evident to so many people across the public than over the past year. People who've received their care are the public we've been trying to protect. And it's often reflected back to me, many of these values in commentary that I receive back on your behalf from members of the public of what they have experienced. So certainly in terms of looking towards building a healthier Ireland, a few key aspects that we will reflect in the plan. Firstly, how do we develop a service now that does really help people live a greater life and a longer life in their communities? Secondly, as part of that, how do we develop the services to support people with their needs at the right time, but particularly in the right place? And all of you will be familiar, this is really about how do we work as a team. And it's often a widely used phrase and commitment in many organisations. But from our perspective, it really is about how do we ensure that the patient and everybody who uses our services experiences it in a much integrated way. It's what I would call a handover between the various services and not a handoff. And finally, how do we continue to build trust and confidence of the public, which is a real key issue the board have identified with ourselves at the very start of this process. And that will be through the experience of patients. It will be about communications, but ultimately it'll be about what the public experience of their health service. And finally, the plan does, as you will see, it sets out a number of priorities. They're not definitive, they're not exhaustive. There are many priorities we have in the health service. At the board with ourselves, we're very anxious to, however, to identify a few key ones that we wanted to invest extra resources and extra commitment in over the course of the corporate plan. Thank you. Next slide, please. The chairman mentioned just briefly the engagement process, and I just want to touch on a few of them. We were very anxious in this process, and obviously we kicked it off prior to COVID with some detailed workshops with the community, with various stakeholders, with staff across the country. Obviously during COVID we were restricted on how we would do it, but we did continue a lot of online workshops, and to the extent that we could with face-to-face. But a significant part of it has been through online engagement and online surveys. And we were quite pleased with the response from the surveys, on 2,500 surveys committed through staff, and 10,500 completions overall. And a range of online initiatives that you'll see listed there. I attended many of the workshops that we did take place when we were in a position to have numbers. And it was quite interesting at those workshops where maybe sometimes the things that we think are always the priorities are on people's mind about their health service. It can be reflected quite differently. And certainly the strongest theme I heard coming back was about community services and was about engaging with the various other health providers in a stronger way, so that we do truly embrace a national health service. One that embraces the public aspects of it, the private aspects of it, the voluntary aspect of it, the Section 38, Section 39 organisations working in a more coherent way. It was a very strong team coming through. Next slide, please. Just touching on the very simply set out in the corporate plan, which is about, as I reflected at the start, a healthier Ireland, delivering the services to the right people at the right place. Supporting people living well, and as I've mentioned, experiencing those services in a very much more integrated way. Next slide. In summary, we've set out 6 core priorities, which you can see reflected in the infographic, but also on the corporate plan. And just to briefly touch on each of them, because I covered a little bit of detail for each of them, but in essence, first of all, we know that we have to continue to protect the public, protect the patients, protect people who are using our services, and protect our staff for a sustainable period through COVID. And there are many aspects of that which I'll touch on. Secondly, we know that what we have experienced over the past while and our plans through Sláinte Care, that enhancing and investing stronger in community services and people accessing their care closer to their home is an experience that people value and an experience that has proven to be better. Thirdly, we equally know that we need to strengthen our acute services in terms of the investment that we can make through increased capacity, through increased flow through, and indeed through better and safer outcomes all across our system and in our hospitals. Fourthly is around services of mental health and how can we identify the early interventions that strengthen our mental health services and how people experience it. And similar on disabilities. What investments can we make that make them really person-centric and that make a much better living standards for people living with disabilities. And finally, we've identified a few key priorities which are around early interventions for children, but particularly looking at aspects of healthcare in Ireland. The Chairman mentioned at the start, there's a lot we have to be proud of about health outcomes in Ireland, but there are a few areas that we are outliers on, particularly in the areas of advanced supports or early supports for children, areas like obesity, areas like alcohol that we know we need to invest in. And finally, you'll see at the bottom of the infographic, which I will touch on, some of the enablers around how we use data, how we use technology, how we invest in our people, and how we support you through increased resources. Thank you. Next slide. So first one, very briefly, is around continuing our supports for COVID from a range of perspectives. And I think it does give us the opportunity here to reflect on many of the learnings that we have all experienced through COVID. And there's a few pieces that will continue to be priorities for us as we work through this. And firstly, it is, and the obvious one, is continuing to protect the public at transmission levels between communications and ensuring the public have the required information at the right time about how to protect themselves and each other during COVID. And that will continue. Secondly, related to new models of care that we've put in place during COVID and are required during COVID. And again, I make the point, how do we not just have put those in for a crisis, how do we sustain those investments for the future to help the acute and the community services? Thirdly, looking at not just a long-term model in terms of testing and tracing, but a long-term, what I would call a pandemic model. There's no doubt we were not built fit for purpose for a pandemic. And that's what we've had to scale up very significantly from very early. Many health systems all across the world were not built to the required extent needed. So we need now to look forward to have a pandemic plan that has the priorities and the resources invested in it that gives us the capacity to scale up and scale down for the future based on various pandemics that inevitably we know we will face in the future. And finally is a key priority, as we all know right now, is developing a safe, secure, effective administration of the vaccines. Now, we haven't covered this in all of the detail here today. We did cover it in some of our national service plans we launched last week. But very briefly to say, we are committed to administering all vaccines as they're delivered into this country on an immediate basis. And that's been our experience to date. 98% of the vaccines which come in are administered and a small proportion we keep back for what's called a buffer for second vaccines that we're required to do. But again, I'm sure we'll have plenty of time to talk and answer questions on that. Next slide, please. Second area. Just wait for the slide to come up. Let me go back, please. Okay, second area relates to what I've been touching on. And I just briefly make a few points here. We have a very significant, and government have a very significant policy plan around Sláinte Care. In my view, what we've been able to do during this crisis has been take a lot of those plans off PowerPoint, off our business cases, off spreadsheets, and support you in putting them into action. And you know, it's about the services. In this case, on this piece of our priority on our corporate plan, is about how do we bring those services locally. And a lot of what we're committing to in the next 3 years as part of the plan are the likes of community healthcare teams all across the country, integrated teams working in a very coherent way, including with GPs, community specialist teams, particularly for areas of older care and chronic disease management. Secondly, diagnostics for GPs, and thankfully in our winter plan, we've had a very significant investment in supporting GPs about having direct access to GPs, not having to always go through the hospital system. Thirdly is leveraging the GP agreement, which we have, and a very different way we've experienced of working with our GPs and GP community across the system last year. The agreement which facilitates chronic disease management being managed in a very different way. GP has been part of those public health, community health networks as well. And statutory home scheme, which we know is a priority for government, and the department are working on a scheme that helps us to address the statutory support scheme in a very different way. And finally, the last two, which we have seen during COVID, we know that what helps the acute hospital system is to have a greater flow through out of the acute system and into step down and community and rehabilitation care, so more capacity in that regard. And then finally, the nursing home expert panel. I think, and I've said it very publicly, we all have to put our hand on heart and look back and see what, as a health system, what as a state could we have done differently in terms of protecting some of our most vulnerable people, our communities living in nursing homes. And the expert panel set that out quite clearly, and we are committed to a number of actions that have come out of that for the HSE in particular. Next slide, please. Oh, just back one, please. Okay, third area relates to scheduled care. And we know this is a real priority for the public, and it's a real priority for all of the people who work in the health system. And we know we want to radically address the issue of waiting lists. It's a very significant challenge for us. We know that, and you've experienced this over a while. But there's a number of actions that we will take to address as part of this. Firstly, as I mentioned, working in a much more integrated way. And we've seen this, and we know how it can benefit, even during the winter plan of the last few weeks and months. By GPs having access to new pathways and not having to refer patients directly into the hospital system for some diagnostics can help. It's a significant part of many people's waiting for care through diagnostics. Secondly, more strategically, looking at elective-only centres. And there are a number of very big strategic plans set out, policies by government and reflected in our corporate plan, looking at trauma strategies for the future, looking at many other strategies that help us now to look at how do we reconfigure a lot of our systems and our hospital systems for the future. Also looking at private capacity. I have certainly experienced over the last while our engagement with the private hospital system in a very new way has supported us. And just even if I look over the last few weeks through our new safety net to engaging with the private sector, over 3,500 bed nights and days used last week with the private health system to support us in addressing some of the urgent care while we are restricted in terms of COVID. So there has to be a better way of us all working together. Dedicated teams at local and local level, national and local level on scheduled care. We have, and our service plan has significant resources committed to putting more people looking at this. And just last night, I was engaged with the Secretary General of the Health Service of the Department of Health, Robert Watt, in just the plans and approaches we can take in a very joint way about looking at this with the Minister. Second last one just there is about health visualisation platforms. And that's a pilot we've been running across a number of hospitals. And we have investment to roll it out this year to over 29 hospitals. And in essence, it's a way of looking at the efficient use of the resources that we have, whether it's theatres, whether it's planning for waiting lists, whether it's addressing the best use of our resources in the most effective way on a 7-day basis. And that is a data system, but in essence, it's a system that supports hospitals and acute systems to get the best use of resources. And finally, looking at something that can be simple but very effective. How do we have it more patient focused, that the care can be addressed in a timely manner for the patient, but equally that we can know what is scheduled, what hasn't showed, who hasn't showed, in a more coherent way. Fourth key objective, if we can just move on please, relates to mental health services. And there is a very key invested strategy by government that you know in terms of sharing the vision, a mental health policy strategy for everyone. And in essence, looking at a few key objectives for ourselves, strengthening our children and adult mental health services overall. And again, thanks to you, we've put in many new initiatives through telehubs and e-mental hubs, but also we don't know we have to put in extra resourcing into our CAMS teams, particularly in terms of timely intervention for children mental health services. And we know we have an imbalance across the country in terms of resourcing and in terms of the experience people have in terms of children mental health. And also again, and this is the issue of trying to get more local, crisis resolution teams, crisis cafes, investing in our community teams so they have the resources and interventions to make at an early stage. Move on, please. Similarly on our disabilities, again, how do we bring this to strive to have the highest quality of life and experience for people living with disabilities? How do we invest so that they are not just invest in, but organise in a very from a person perspectives way? What's that person living with disabilities? Are we looking at from their lens and their experience of the services? And that's been a consistent piece that we get back to our report, that we know that's an area we have to do differently and we have to do better. And finally, in terms of congregated settings, and how do we move from, and we know it's an invested plan by government, but we know, and I visited with many of yourselves, the experience of people living in the community with the supports, through some of ourselves, through some of our Section 38 and 39 organisations, and much better lived experience for people in the community. Sixth and final key objective for us is, as I mentioned at the start, is about addressing some of those outliers that we know as a state, as a nation, as a health service, we want to invest in stronger. And they are in the areas of early interventions for children. How do we support, again, our community teams to have greater strength and capacity at a local level? And I do believe the community health networks will be huge value add in terms of this. Partnering with other support organisations will be key also. A lot of our communications and campaigns are also key, particularly around the likes of Stop and Quitting Smoking, which we know has proved very successful. And we know again that there's significant catch-up we have to do in terms of alcohol use across the country. So I think a lot of the actions in this part of the plan are about investing locally, whether that's community-based teams for children supports, whether it's community-based teams in terms of obesity supports, or indeed alcohol and indeed drug use as well. Next one, please. We do also know, while the first few objectives I've reflected for you there will be setting out the public experience of health services and what we see as a priority, we do know also that we have to invest internally in a range of initiatives, enablers, to support you that person's experience has improved and is better. And I'll just touch on some of them very briefly there. And the first one is around that person's safety, quality, the experience of people when they use all aspects of our services. And we know there are many improvements that we have to make. And we have regular and good discussions with our board, and there's a dedicated committee of the board focused on safety and quality of our services. And we know there's been many reports, and you have fed it back to us around openness, transparency, what the public, what the patients want to experience from their services in terms of openness and transparency. Secondly, in terms of data and information, and there's one thing certainly I have learned very, very strongly in the past 20 months, and particularly during COVID, is we have a lot of data in the health service but it's very disaggregated all across the system. And what we've learned to do during COVID is develop more what we would call data lakes, more central repositories where we can put a lot of our data and information into, and then analyze it in a way that will give us better insights into priorities of healthcare. And it just alone, very recently, from our testing and tracing data, from all of the swabs taken across the country, from all of the vaccine data across the country, we're able to clash a lot more data that will inform our health system and priorities of the health system much better. Technology and e-health, again, great learnings from the initiatives that you have driven throughout the country around the requirement and the need and the benefit of using a lot of e-health solutions. I won't list them all here, but there have been many experiences across the country where we've been able to put, whether it's remote technology in place or technology in place for the person to have their care done in a remote monitoring way. And that has even been happened through COVID, where we've been able to, in our acute hospital system team, support technology for remote monitoring of people who may not need advanced respiratory support, but they do need to be monitored at home. In terms of communication and engagement, my commitment and commitment from the board is that we will, and we are working hard to create a continuous ethos of being open and transparent with the public, being open and transparent with our staff. And I certainly have invested with the executive team a lot of time to engage with our staff, whether it's through webinars. Unfortunately, it's not appropriate for us to be visiting locations on an ongoing basis, but that is a commitment that we make, that we are visible to yourselves and we lead from the front. Finally, just on infrastructure and investment, which relates to a lot of our capital plans. Health service comes in for much criticism at times in terms of, particularly for some very big public capital investments like the Children's Hospital. But we know that will be a fantastic investment for the future of healthcare, children's healthcare in Ireland. But we also know for many of the multiple strategic investment projects our estates management teams run in the health service, we do a fantastic job. Many of our big projects are delivered on target, on budget, within time. And two very significant investments this year alone, over the course of last year, is the National Forensic Mental Hospital in Portrane and Donabate, and also the National Rehabilitation Hospital, an extra 120 beds put in place. Very significant, big strategic investment. But it's also about some of the smaller investments to help us, whether it's in a community setting or indeed in a hospital setting, for a particular ward or particular renovations that have to happen. Next slide, please. Finally, I just want to touch on, for ourselves, the people, and people who work in the health system overall, and the priorities that we are setting out overall here. And firstly, I want to make the point, we want to do this now in a more strategic way in the future. So we do have a strategic workforce plan, which we've worked on with the board very strongly over the last while. Many of you have reflected to us around some of the deficiencies about resourcing. We want to do that in a more coherent way for the next 3 years as part of the corporate plan, and very positively. You may have seen from our national service plan just last week when we launched it. And we have support for funding for 16,500 staff to be recruited into health service. One of the biggest significant investments that we've ever put in place in the health system overall. Sorry, I might just put a light on the background here. So it's a very significant investment that we have to put in place, and we will put in place. But we wanted to do it in a way of a 3-year time frame. So it's not just a 1-year investment, it's a sustainable investment. But certainly this year, 16,500 investment. That's consultants, that's doctors, that's nurses, midwives, healthcare assistants, and many of our therapists that we want to put in place in the community. Some of the management and admin that you need to support you. We also want to work on the culture of the HSE. And certainly my learning is the HSE is a very big organisation. And there's probably no one single culture that we can say, but we do know there's one single set of values that we all want to work towards. And I want to build on that work. But we also know what culture we value, and we also know what culture we don't value. The The last couple of points I just want to say is the supports that we put in place for yourselves, and we want to invest to make sure. We know this has been a very difficult year, and the next 3 years are equally as challenging. But we want to know that we're creating the right environment for you in this health service for the future. Next slide. And there is a challenge for us in terms of what do we need to do to become the best health service, and to be very proud of everything that we're doing. And it is around, some of it is around people. There's a lot of different interpretations about what a high-performing organisation means. Well, ultimately, it will mean the experience of the people that we're serving, the public or patients, and all of user services is stronger and better. But there are things we need to do internally. We need to look at structures that give a lot of the services locally. One of my strongest learnings during COVID in this phase was, and I've said this very publicly, I've never seen so much change implemented by so many people so quickly over such a short space in time with such benefit. And I've spent 30 years of my career in the private sector where it's always put as the benchmark. Well, I certainly have never seen such change implemented. So we know we can do it. We want to do it in a way that the centre can give a level of direction and oversight. That's what we will always have to do. But equally that we unlock the system so that you feel empowered, but you feel unlocked to be able to go do, which is exactly what we did during COVID. We also know we need to strengthen accountability in the organisation. Who's responsible for what? And certainly one of my early experiences was we are sometimes confused at an organisation level between the role of the services versus the role of the centre, at an individual level between roles and responsibilities. So we have to strengthen our accountability overall across the organisation. We have to strengthen our performance management across the organisation. Many of you, I know, and reflect back to me, get quite frustrated that you work relentlessly and some people are underperforming and it's not tackled. That's something we have to value too. We also have to value that we do say well done to people, and we value that people highly perform all across the organisation. And finally, we want to continue to strengthen our financial grip on the organisation. And that, in essence, I would say, has been the reason, because we put such a focus on it with our board in the first year, has been one of the reasons we have been able to secure from government an extra 21% of funding, over €3.5 billion of funding committed from government, because I believe for 2 years in a row now, we have delivered what's called a break-even budget. We broke even between the commitments that we made through the course of the year and a commitment for the year end. And that is widely, I know, because it's fed back to me, valued by government. So I think that's something we will always need to be focused on to ensure we're getting the best value supports and best value from money invested. Finally, I just want to briefly reflect a couple of points if I can. Next slide. I won't go through detail. It might be a bit tight on the screen, your screens here, and it is on page 24 in the corporate plan. But I just want to, I think this reflects for me a few priorities that we value and we will hold true to during the corporate plan. And first one is we continue to be flexible and agile. Nobody can challenge our responsiveness during COVID, and definitely beforehand, our responsiveness, our agility. Other things like, always reminding ourselves, everything we do, all our processes have to be designed from the patient inwards and not from the centre outwards. Action orientated. I want us to continue to take the actions we have taken on a prompt response that we did during COVID. With the board and myself and chairman, we've been very open to say, and we should continue to be very open to say, at best 70% of the actions we take will be successful, and most likely 30% of the actions won't succeed, or in some case will be the wrong ones. But we have to carry a culture and be firm that that's a culture that values us taking action. And yes, we will make mistakes and we will address them when we make them. For a couple of other points I will just make on that is about policy. We are an action-orientated organisation. Our role is not to develop policy, that's the role of government, the role of the department. But we are an organisation that puts that policy into action. But we also have to be an organisation that helps inform that policy. And final two pieces in there, which I did mention, we have, I believe, demonstrated the pace of change. And the final one that's reflected on this infographic is that a strategic oversight. With our board now, we have what's called a national scorecard, which in a very concise, coherent way, we're providing oversight of this corporate plan. We're providing oversight of our service plan. So we want to remain focused on the actions that we're committing to. So a couple of closing comments from me, if I can, on the final slide, which is just all that I've reflected on that. I want to reflect it again. The responsiveness, the agility that we have demonstrated, I believe has given us a very new connection with the public overall. It's given us a way that we are trusted more, and we can track that, and we have seen our trust improve. So I want us to build on this as part of the corporate plan. Our board have been very anxious that we provide the learnings, and we engage in a very extensive process with the board during last year to assess the learnings from COVID and what we embed as part of our corporate plan and what we embed for the future. We are committed to making, with you and with your support, very lasting changes for people, for the population, for the staff. This is a 3-year plan. We won't solve everything in 3 years, but I think if we continue at the pace and focus and action orientated we've been working on, because the good news is, the final point on that slide is, our National Service Plan, as I spoke to, which in essence is year 1 of our corporate plan, we have secured the best investment we could have hoped to achieve. There can be no challenge to us ourselves if we only had the funds. We have €3.5 billion funds extra. Half of that is geared towards continuing to protect and the protections around COVID. And the other half is geared towards non-COVID. Over €1 billion invested for this year in new innovations, things like access to care investment to help address some of the waiting lists. So in closing, as the chairman did at the start, and I will at the end, I want to thank you for everything you've done just during this year. I do believe we have a corporate plan now that's very coherent, very concise, and articulates some of the real priorities for us for the future. And I want to thank you for your involvement in the process. And I'm going to pass you back to Mark Brannock now, who will share with the executive team some questions and the chairman some questions and answers.
Okay, thank you very much, Paul. We asked people to put questions in the chat function, and there's quite a number in. I'm conscious we don't have a huge amount of time, but this is the first of quite a number of engagements that are going to take place over the coming months in relation to the corporate plan. So what I'll do is I'll take questions of which there have been a number of repeats and variations, if you like. And one of the most common themes coming through is about resources and staffing and personnel. People are saying there are ambitious plans for resourcing, but as one person says, is that all just promises? How do we entice highly skilled healthcare staff living abroad to come home? How do we deliver on the very ambitious plans to recruit the extra resources that very many people who've asked questions say are just really badly needed in a range of different areas?
Mark, I'm not sure how I would like to invite Anne-Marie Howie, as National Director of HR, to maybe chair, and then maybe the chairman make some comments. If that's okay?
Yeah.
Yes, sir.
Yeah. Thanks, and thanks, Paul. So as Paul mentioned earlier in the presentation, we have received, I suppose, an unprecedented level of investment in new resources since the end of 2020 and until the end of 2021, over 16,000 posts. And if we look at that in context, in recent years, our average net increase in staff has been around 3,000 or thereabouts. So that just puts in context the level of investment we have this year. And that is intended, I suppose, to build our strength and our capacity to support all of the service initiatives and service developments that have been described in the presentation earlier. In terms of our ability to recruit, it certainly it's challenging, but it's a huge opportunity. And we have started on that path for the past number of months. And at the end of January, we had recruited, since the beginning of 2020 to the end of January this year, we had recruited recruited an extra 7,500 staff into the system. That's a net increase of 7,500 staff into the system. And that's in addition to the replacement posts that we would have recruited last year. Our objective is to recruit highly skilled individuals into all of the staff categories that have been described. And then when we do recruit those, our objective has to be then to induct and to train and to continue to develop and empower the staff when they are recruited into the system. So as I said, at the end of January, we had an additional 7,500 staff, and we are continuing to recruit across a number of channels. So we have increased our capacity to recruit, and we will continue to do that over the next number of months to ensure that we maximise our efforts to recruit the staff to enable the various initiatives to be delivered and supported.
And if I can, Paul, just add, and I think it's that last point that Anne-Marie made, the recruitment is one of the risks that we've been worrying about as the board. But what we really need to do is make sure that in creating the 96 community healthcare networks, that we're able to show the impact that has for the patients. Because when the Taoiseach was saying the other day that he would love to be in a position to continue this increased level of funding that we've benefited for, being able to demonstrate the changes and the impact that they have for the public is going to be key to that. That's where this trust and confidence thing comes in. And if we can get that right, then all the other good things in the plan can happen. Because as Paul said, having had 2 years in a row now of landing the money where we said it should be, and we had agreed it should be, if we can add the credibility we got to that, from that to the credibility we get from showing the impact of the investments that we've had through the winter plan, for the service plan, then that's what will drive the future. But people are key to that, and as Anne-Marie was articulating, it's something we're worrying about hugely.
Okay, one more question, which has been repeated very many times, and that came in this morning, is in relation to the backlog in waiting lists. Someone says after the pandemic, we have obviously an understandable backlog in waiting lists, but what capacity are we going to need in the system to address that? And as someone else says, will we ever address that?
If I can make a brief comment, Mark, and ask Dean maybe to come in on this one, very briefly for me. I was actually on a phone call very late last night with the Acting Secretary General, Robert Watt, and we were talking specifically about this, and our intention is to put together a joint set of teams now to strategically look at this. We do have a €240 million investment in the first year of the plan this year to look at this. The only brief comments I would make was, I believe the solution is going to be a part of increasing capacity in the public system, working in a very different way with the private system will be part of the solution, I believe, as well. Private hospital operators, but also looking at very new ways of working and new ways of delivering healthcare. We've seen a lot of innovation and technology that we can put in place. But I might just ask Ian to make some comments.
Thanks, Paul. Thanks, Mark, and morning, colleagues, and thanks for joining today. It's undoubtedly the case that waiting times are beyond unacceptable at the minute in terms of the length of time that some individuals are having to wait either for an assessment, for a diagnostic, or for a treatment. And we know there's a context for that, given COVID and the challenges that has presented, but the issue was there before that as well. And COVID has just exacerbated things. But at the same time, COVID has also flagged up significant opportunities in terms of different ways of doing things, different ways of delivering outpatient assessments, different ways of delivering particular types of endoscopy services, and so on. So what we're trying to take forward, as Paul has referred to already this year, is in partnership with key stakeholder organisations, and particularly the department and the National Treatment Fund, NTPF, taking forward a comprehensive programme. Firstly, to reduce the damage that COVID-19 has done to core capacity in terms of the number of outpatient assessments to be delivered this year, the number of treatments, the number of diagnostics over and above the community diagnostics that Paul talked about earlier on, but also very importantly to fix things from the inside out in terms of getting to the core of the problem, understanding where the true gaps are between demand and capacity, so that as well as focusing on the waiting lists that are built up, the backlogs that are built up over time, that we start to put in place arrangements that will ensure that we don't have waiting lists building up in the future. So a combination of starting to clear the back end of the waiting list, but also very much focusing on the transformation that is required to avoid waiting lists being created in the future. And finally, and again, as Paul has said already, a couple of key points. Firstly, the vote of confidence from government. So over 200 million worth of funding given to the HSE in 2021 to tackle waiting lists. Over and above that, another 130 million given to NTPF as key commitments in this space. And I believe through both of those and then the additional resources that we have directed towards both supporting transformation at a national level in terms of a core team being established within the centre of the HSE, but as are more importantly supporting CHI and the groups to take forward change with investment in each of those. I think we'll begin to see demonstrable progress towards the back end of this year and then really kick on from next year when hopefully the pandemic is well behind us.
Mark, sorry, with your agreement, sorry, Dane, could I just ask Yvonne, maybe just make, because we always think of the acute hospital system, but Yvonne is obviously looking at ways we can do it in the community as well. So Yvonne might just have a couple of comments. Thanks.
Good morning, all. Thanks. So yeah, only to add, I guess that first of all to thank the staff who are listening in terms of how we have adapted, and both Kieran and Paul have referred to this, the use of technologies to begin to continue a level of delivery of services during COVID, which has meant our waiting lists, haven't worsened to a greater extent than they currently are. And we've had in January alone 21,000 attend anywhere consultations across community services in 1 month. That's very significant and goes back to the point that's been made earlier about the speed and agility that technologies were adapted in response to COVID. I wouldn't for a second want to underestimate actually the concern that we have around the increased waiting lists for some of our primary care therapy services that are very significant, particularly across speech and language and physio. And we'll certainly be targeting those, as Paul has said, around some realistic initiatives that we could work to for the remainder of 2021, where we want to acknowledge that such a high proportion of those therapy staff were redeployed during since the beginning of COVID, but at a reducing level coming into the end of last year when the rates of COVID reduced. The other thing, and this connects to how Anne-Marie was summarising the focus as well, there has been a significant focus on recruitment of our basic grade allied health professionals to supplement what will be increased opportunities for promotional posts as well, because of the level of senior posts that are seen in the model of care that's coming forward through the enhanced community care services. And just finally as well to acknowledge that notwithstanding that we were in a very difficult context, our colleagues across primary care and disability services have done some very specific targeted improvement work in relation to reducing the number of those waiting for assessment of need over the last number of months, which is really welcome, and we hope to see that backlog reduced to nearly zero by the middle of this year. And just to acknowledge as well for people who are dialing in relation to some of the points Paul made earlier on our mental health services. I think there's been, and it's been partially as well to do with the use of the technologies, but there's been a significant achievement during COVID in being able to maintain a level of service to those most in need in our mental health services, where we have maintained seeing urgent referrals at basically within our 3 working days for CAMS at 95% of all referrals, and within our 12-week times for across general adult and older persons. And that's not to say we haven't had very significant, I think, and we will see this over, I think, the next 2021 and beyond, significant demands, not just on our mental health promotion and improvement services to respond to what we know will be the psychosocial impact of COVID, but also there's very significant issues for meeting needs for those who have more complex needs across all our community services, mental health and disability. Thanks, Paul.
Okay, and actually following on rather well from what Yvonne was saying about community services, we have somebody here saying we can't forget about acute services. I see a lot of funding going to community services. How are we going to ensure funding gets distributed correctly and that acute services get what they need?
Just sorry to make a brief comment on my call on Jean again. Just the there's actually over 800 million, 804 million extra in our national service plan for this year for acute services, and we're very conscious that it's certainly about beds, so 1,150 extra beds as part of the service plan this year. But the board and the executive team are very conscious about the strategic commitment to flow through to elective care, to investment in infrastructure in our hospital services. We know we're dealing with very antiquated and particularly some of the IT infrastructure that is in our hospitals. So we know there's a very significant investment in hospitals as well. But at one point I would just make on this, and I know it always comes up, is when we talk about enhancing services in the community, you know, it's not an either or. This is about investing in all of our health system, but it is about investing in a more integrated way. So anytime I talk about hospitals, the community services quite understandably challenge me, saying why it's about the community. And we're talking about community, understandably I get challenged about hospitals, but it is about a more integrated service, I would say. Unless anybody wants to add anything. Yeah. Okay, Mark.
Okay, one more very specific question. Does the plan include implementation in full of the maternity strategy?
Ian, do you want to?
Yeah. Certainly the plan assumes, colleagues, that we can make material progress with the implementation of the maternity strategy over the course of it. And as Paul was referring to earlier, a number of investments that were set out within the service plan that was launched last week in this space, one of which was the investment in 2021 to allow the progression of the maternity strategy, so 12 million euro going into that during 2021. So if it's not fully implemented by the end of 2024, we'll be very well on our way to full implementation by then.
Could I just briefly invite Mark? Sorry, go ahead. Your chairman's going to ask you.
Yeah. Sorry, Paul. And can I just say, I think there's a principle here, which is that strategy should be funded. And I know the Minister was very keen in the funding of this year's service plan to make sure that money was directly allocated into the various strategies. And I think that's a principle he's very keen to promote, and the department is, but so are we as the board and the executive, that where we participate in the development of strategies, and when a huge amount of great work is put into developing them, that actually the funding comes with them, and we don't commit to implementing a strategy if the money isn't there, and have that conversation up front. But so as a principle, I think we have to hold to that.
Mark, sorry, just before you answer one more, can I just invite Colm in? It might not just particularly in the Women and Infants programme, but just generally in that acute investment. Colm is dealing a lot with our clinical teams, clinical aides. You want to make any general comments, Colm?
Yes, a lot of the plan is underpinned by the need to produce more integrated care, as been referenced already. So particularly when we look at chronic disease and older people, if we look at the level of investment over the past 10, 15 years, it's been very much in the acute end of, and not enough in creating loops of care for older people and for those with chronic disease that don't have to go through hospitals. So we've seen this in our winter plan, the beginnings of that in the translation of the models of care we want to see implemented, particularly for those two big groups which comprise a significant proportion of people who present to acute hospitals. We can create credible pathways of care that do not involve people coming to emergency departments, that can be completed outside the hospital, that can be supported within the community and can support GPs to do that work. So I strongly agree this isn't either or. What we're moving towards is creating, bearing in mind the challenge of this generation isn't infectious disease, apart from COVID, of course, but it's aging, people who are aging in chronic disease. If that's our challenge, we have to meet it by creating new types of care that don't depend on people getting sick enough to come to emergency departments before their needs can be addressed.
Okay, thank you. I'm conscious we're very close to the end of our time. If I might mention just an issue which we mentioned earlier, but just there's an awful lot of questions about it, which is recruitment again. Someone here saying, we hear what you're saying, it looks very slow on the ground to us. Is there anything further we can say to people about what it's going to look like next year and on into the future?
Can I make a brief comment on that? Maybe Anne-Marie again. Just brief comment. At the executive team, and Anne-Marie brought forward proposals that evolved a significant proportion of the recruitment to local level, to local services, so that we were not, delaying the process and giving that delegation down to communities, hospitals, and our general services. That's one aspect of it. We're also looking at, we've been dealing with the public appointment service about some of the pipeline, particularly recruiting some of the professional grades and particularly recruiting some of the consultants. About that had been a very long tail of recruitment, and working with the public appointment service on that also. So a lot of delegation, a lot of looking at the recruitment. And thirdly is about, we're engaging now some recruitment partners. So not just trying to take it all upon ourselves, and some of the so through some recruitment partners and agencies for full-time staff, but being recruited through. And then finally, we are resourcing as part of this some of the HR people in some of the local services as well, because some of the local services don't naturally have the capacity to recruit at the level required now. But Anne-Marie, do you want to add anything extra to that, please do?
Yeah, no, I think that's a good oversight of it, Paul. So I suppose we are coming from, a background of having a certain level of capacity to undertake recruitment. And over the last number of months, we have been building on that capacity. We're also working very closely with the heads of HR in the services so that we have a clear strategic direction in terms of who is recruiting for what. We'll have recruitment done at local level. We'll also undertake recruitment at national level through the National Recruitment Service. We've also been building our capacity with some third-party providers. Paul has mentioned working with the public appointment system, and we're currently just finalising a tender for a managed service provider to build more capacity over the remainder of the year. So I suppose in summary, what we're doing is building capacity. We've also looked at our recruitment processes and any opportunities to make our processes more efficient. And we continue to work with the national and the local services to improve our processes and to make them as efficient as we can, balanced with the need, obviously, to undertake appropriate recruitment. Thanks, Mark.
Okay, thank you. I'm conscious that we're out of time. I'll ask in a second Paul and Kieran if they have any closing remark to make, just to say that there will be further sessions and webinars with staff around the country in different services over the coming months to engage on this. I want to thank Vanessa and Michael, our Irish Sign Language interpreters, and to note that the recording of this is going to be made available afterwards on email to people with the link. So finally, maybe Paul and Kieran, if you have some final words to say.
I'd say briefly and leave the last word to the chairman. I just very briefly for me, I think we have great room for optimism for our health service for the future. It's been a difficult year, but we do now have a strategic direction. We've a well-funded year one of that plan, and I've no doubt with increased confidence we'll have a well-funded year 2 and 3. So I think we have a lot of room for optimism. And final comment to me again is, I think we have done the state well, we've done the health service well, and I want to thank all of you for everything you've done over the past year.
And just to add to the thanks, it's been a really, really tough year, but hopefully we're beginning to see the light at the end of the tunnel, like everyone else looking at the COVID app, no COVID admissions to ICU in the last 24 hours. That's got to be trending in the right direction. So hopefully we'll get through that. There's a huge amount to do around waiting lists, as people talked about. But just to reiterate the thanks, it's been an amazing performance by the staff of the HSE, and it's been an inspiration to watch it. So thank you.
Okay, and thank you very much. And as you say, this isn't the last time we're going to be discussing this. You'll see maybe some press coverage tomorrow. We're having a press launch later on of the corporate plan, but thought it was important to launch it, albeit briefly, to staff first. So thank you very much.